So let's quickly see what aortic dissection is. So basically what happens due to risk factors like hypertension and atherosclerosis, a tear is produced in the intima of the aorta. This tear can extend to the other side, so the media and the intima can get separated from each other and blood would now flow between the intima and the media. So there is a false lumen which is produced. So you have a true lumen where originally the blood was flowing, and now you have a false lumen. So you have a double barreled aorta, like a double barrel gun. So there are two lumens through which the blood can now flow. So if the risk factor is uncontrolled, for example, if the BP is very high, this intimal tear can extend to medial tear, which can extend to adventitial tear, and finally the blood can leak out of the aorta, causing a fatal hemothorax. So this is what actually happens in aortic dissection. As we've seen, the patient would present with chest pain radiating to the back, and also the clinical features would vary depending on whether aortic dissection has taken place in the ascending aorta or the descending aorta. So there are two classifications. One is Stanford, another is DeBakey, which are used for classifying aortic dissection. As a part of investigation, what we usually do is CT angiography and transesophageal echocardiography. An X-ray can be done to see the wide mediastinum. As a part of treatment, what we do is, so immediate treatment is in the form of managing pain and controlling the hypertension if that is the cause. And the definitive treatment is with the help of a Dacron graft repair. So yeah, this was a short summary of aortic dissection. You all can surely read it in detail from the books. I hope you all got the concept. That is the main aim of this channel. So please keep subscribing, keep liking, keep sharing this channel as much as you can so that it can reach to all our friends. So yeah, thank you. Keep liking, keep sharing and subscribe to this channel so that you can be updated with other case scenarios. Stay tuned. Thank you.